The United Kingdom has secured a deal for an initial delivery of 5 million doses of a brand new vaccine developed by the US biotech firm Moderna. The deal means that the vaccine could be delivered from the spring of next year if it's approved by the regulator. The Health Secretary for England, Matt Hancock, warned that the safety data was limited and that the firm's production facilities were not yet fully developed. Moderna says that the trials so far show the vaccine is almost 95% effective. It's been tested on a range of people, including the over 65s, people with underlying medical conditions and those from different ethnic backgrounds. And crucially, it can be stored at normal refrigerated temperatures, making it much easier to distribute possibly than the Pfizer vaccine announced last week. Well, there are currently around 50 vaccines being tested worldwide, and the latest success has raised hopes that others could be on the way. Our medical editor, Fergus Walsh, has the story.
Another dose of hope and further evidence that vaccines will provide a way out of this pandemic.
Thank you.
Stunning early results from this trial from US firm Moderna have eclipsed the strong ones just a week ago from Pfizer-BioNTech.
I broke into an ear-to-ear grin when I heard the numbers. It really exceeded our best hopes. And it is an incredibly exciting moment for us as a company and as a world as we start to develop tools to fight the virus.
30,000 volunteers in the US took part in the trials. Half had 2 doses of the vaccine a month apart, the rest dummy injections. Early analysis shows there were 90 COVID cases in those given the dummy treatment and only 5 in the vaccinated group. Moderna says this shows the vaccine is over 94% effective at preventing COVID. What's more, there were 11 cases of severe disease, but none among those who got the vaccine.
I'd like to update you on the latest coronavirus data.
The government urged people to follow the COVID rules because even an effective vaccine won't change the way we live for months. But optimism is growing. Are you a bit more confident today, even more confident than a week ago, that COVID vaccines will work?
It's brilliant news, absolutely brilliant. It's the second penalty now. That's also gone into the back of the net. So we're starting to feel in a better position.
Moderna, like Pfizer, have used a completely new method for creating vaccines which doesn't need the virus itself. It uses the genes for the coronavirus spike protein. This synthetic code, known as RNA, is created in the laboratory and forms the vaccine. This teaches the body to recognize and build an immune response to coronavirus. The Moderna vaccine doesn't need to be stored at ultra-low temperatures like Pfizer's and will keep for up to 30 days in a normal fridge, making distribution easier. Before we can all throw away our face masks and ditch social distancing, we're going to need to protect the world from COVID. That will require billions of doses of coronavirus vaccine, and it's why clinical trials must continue. Like this one, which began today in Southampton and other sites across the UK. The jab from the Belgian firm Janssen is one of 6 COVID vaccines pre-ordered by the government.
Over time, we will learn which of those works better in different ages and different people with different conditions, and also how to use the vaccines in combinations to give people the best and longest lasting immunity.
Caution is needed. We still need full safety and effectiveness data for the Moderna and Pfizer jabs. But there's a real sense now that some of the most vulnerable to COVID could be immunised before Christmas.
And Fergus is with me here in the studio. You allowed yourself a hint of a smile a week ago, Fergus. So how would you guide viewers along the hopes which attach themselves to this second vaccine?
Well, the smile is even broader tonight, Hugh. It's hugely encouraging. It shows last week's positive news was not a flash in the pan. Now, we've got to be cautious. The numbers could change. Wait for the safety data. But 95% effective. That is beyond the dreams of any scientist involved in this research. And on the Moderna trial, there were 7,000 people over 65. There were thousands of volunteers with serious risk factors, and there was a wide range of ethnicities, so all very promising. Now, if the vaccines get approved, we can start at some point, maybe around summertime next year, to start planning for a post-pandemic future. Now, Moderna, we've got enough doses coming by late spring to immunise about 2.5 million people in the UK. Pfizer, enough doses for 20 million people. Most of those will start coming early next year. And then the Oxford AstraZeneca vaccine, we will have enough doses next year to immunise 50 million people in the UK. But we have to consider the world. This is a global pandemic. But given the devastation to lives and livelihoods from this pandemic, it is heartening to be able to report more good news.
Fergus, indeed. Thank you very much again, Fergus Walsh, our medical editor.